COVID-19 vaccine is making its way to North Dakota now, and it's been a mad dash to get a vaccine ready, but there are still steps to take in order to prepare here in the capital city. And new this morning, Nikki Johnson spoke with the manager of the Sanford Hospital Pharmacy to learn more.
We've been preparing for months, actually. As soon as we found out that the vaccine was going to be available sometime before the end of the year, I think way back in August, we started getting groups together to talk about acquisition, distribution, administration, and recording of those vaccines, and also trying to come up with priorities for who gets the vaccine first.
With direction from the federal government and the state, Phase 1 goes to the essential healthcare workers that are working with COVID patients. Then Phase 2 to patients in long-term care facilities like nursing homes.
The vaccine will probably be limited at first, so it might take some time to get through those first phases, but after that, then it'll roll out to more of a general public.
Healthcare workers at hospitals like Sanford get first priority for vaccination, but not all workers may receive one right away. It depends on the supply the state receives, and hospital workers won't be penalized if they choose not to vaccinate.
There is no mandate from the federal government to take it, and we're not mandating it here at our work. It's not to say that some employers may mandate it down the line, but we are not at this point.
Vaccine or not, all workers will continue to wear the proper PPE at Sanford after it's distributed. So when will they start?
The state has put the order in for us, and we're expecting it optimistically within the next few weeks at least, before the end of the year.
This is new territory for pharmacies, specifically when it comes to storing Pfizer vaccine, the first one that will arrive at Sanford, which requires ultra-cold freezers.
We have a ultra-cold freezer in our pharmacy right now. It's got a CO2 tank backup in case there's a failure. And we also have it on an emergency generator to help with any issues we might have with the freezer, because we surely want to be good stewards of that vaccine. We don't want to waste any because of an equipment failure.
It's a large stand-up freezer set at 75 degrees below centigrade to keep the Pfizer vaccine cold enough for optimal storage. They will even check the vaccine every 15 minutes to track the temperature.
Once you take it out of ultra cold and you keep it under either regular frozen or refrigerated, it's only good for 5 days. And then once it is taken out of that refrigerator and diluted, we have 6 hours to give it.
Reporting in Bismarck for KX News, I'm Nikki Johnson.
And he says that the Moderna vaccine that will be coming later will be stored at a 20 below centigrade. And as of right now, they don't know the expiration dates of the vaccines. He said that their biggest challenge will be getting those ultra cold freezers to the rural hospitals since they are so rare. And so we will have a lot of planning to get that vaccine out to them in a timely fashion.